I welcome you all to my channel Explore Medicine. So here is my first video on anatomy of pectoral region. So here we'll be discussing what is pectoral region, what are the landmarks, what are all the fascias and what are all the contents present in this pectoral region. So pectoral region is nothing but the anterior part of the chest is what you call it as pectoral region. So what are all the important landmarks? So here we have got an horizontal bone called as clavicle. So this clavicle has got a medial end and a lateral end. So medial end articulates with the sternum to form the sternoclavicular joint, and the lateral end articulates with the acromion of the scapula to form the acromioclavicular joint. So in between the sternoclavicular joint, you have got a notch called as sternal notch. So 5 centimeter below the sternal notch, you have got an angle called the sternal angle or angle of Louie. Now this is important because the second rib articulates with the sternum via the second costal cartilage at this point. So it is from here you start counting the ribs as 2, 3, 4 and so on. So that is the importance of the sternal angle. And another important bony prominence is coracoid process. So how you're going to palpate coracoid process is you're just going to palpate it deep below the clavicle, 2 to 3 centimeters below the clavicle. You will feel a prominence called as the coracoid process. And the other 3 important things you have to know are the mid-sternal line, that is the line passing through the middle of the sternum, mid-clavicular line, that is the line passing through the middle of the clavicle, and the anterior axillary fold. So anterior axillary fold is, how you can feel the anterior axillary fold is, so first you are going to abduct the arm and you are going to adduct it against the resistance. So you will feel a prominent fold in the anterior part, and that is called as anterior axillary fold. So next one is we will be discussing about the fascia. So here we have the superficial fascia and the deep fascia. So superficial fascia, basically as soon as the skin is incised, the fat what you see is what you call it as superficial fascia. The mammary gland forming this part will be discussed in the next session. So next one is about the nerves and the vessels. So here we have got the cutaneous nerves and the cutaneous vessels. So cutaneous nerves are formed by the medial, intermediate and the lateral supraclavicular nerves formed by C3 and C4. And we have got the anterior cutaneous nerves and the lateral cutaneous nerves, which are all branches from thoracic nerves. So anterior cutaneous nerves are branches from thoracic nerves T2 to T6, and lateral cutaneous nerves are branches from T3 to T6. So T2 helps in the formation of the intercostobrachial nerve. And the intermediate segments, your C5, C6, C7, C8, T1, they are involved in the formation of brachial plexus. So that we will be discussing in the upcoming sessions. So next one is the vessels. So vessels accompanying these nerves are, we have the perforating branches of the internal thoracic artery accompanying these anterior cutaneous nerves, and we have branches from the posterior intercostal arteries accompanying these lateral cutaneous nerves. So we have another muscle called as platysma. So platysma is nothing but a broad sheet of subcutaneous muscle which extends from the deep fascia covering this pectoralis major and crosses the clavicle and gets inserted into the lower border of the mandible. So for any muscle, you need to know its origin, you need to know its insertion, you need to know its nerve supply and then action. Nerve supply of this platysma is via the facial nerve. And what is the action? So when this platysma is going to contract, you're going to see the wrinkles in the neck region. So when the facial nerve is going to be paralyzed, you're going to see the paralysis of these muscles, so therefore there will be absence of wrinkles. So that is the clinical significance of platysma. So next one is we will be discussing about the deep fascia. So when you talk about the deep fascia, so deep fascia has got its extension superiorly to the clavicle, anteriorly to the sternum, inferiorly to the rectus sheath, and infralaterally to the axillary fascia and supralaterally to the deltopectoral fascia. So this is about the extension of the deep fascia. Now the contents, the important contents of this pectoral region are the muscles. So here we have got 4 important muscles. We have got pectoralis major, we have got pectoralis minor, we have subclavius, and we have got serratus anterior. So pectoralis major takes its origin from the clavicle and from the sternum. So we have got the clavicular part and we have got the sternal part. So clavicular part originates from the medial part of the clavicle, and the sternal part originates from the sternum and the first 6 ribs. So it takes origin like this and gets inserted into the lateral lip of the bicipital groove. So you have got a bicipital groove which has got a medial lip and a lateral lip. So this gets attached to the lateral lip of the bicipital groove. So the nerve supply of this pectoralis major is by the medial and the lateral pectoral nerve. So action, so basically when this is going to contract, you are going to see the adduction and the medial rotation and the flexion of the arm. So that is the main action of this pectoralis major. Is there any clinical significance of this pectoralis major muscle? Yes. So what is the clinical significance of this pectoralis major muscle? So basically when you're going to have a fracture in this clavicle, you're going to have a fracture fragment. So when this muscle is going to contract, this is going to pull the fractured fragment downwards, and you have got the sternocleidomastoid above the clavicle. So that is going to pull the fractured fragment above. So therefore there is going to be overriding of fragments. So that is the clinical significance of pectoralis major muscle. And then you have got pectoralis minor muscle. This takes origin from 3, 4 and 5th rib at the costochondral junction. It gets inserted at the coracoid process. So the nerve supply is again by the medial and the lateral pectoral nerves. So action is when this muscle is going to contract, it is going to protract the scapula. So that is the main action of this pectoralis minor. So is there any clinical significance for this muscle? Yes. So what is the clinical significance? So we have axillary group of lymph nodes which is divided into 3 different groups based on their relation to this pectoralis minor muscle. So that is the clinical significance. It's a very important MCQ too. Next one is the subclavius muscle. So subclavius muscle takes origin from the first rib and then gets inserted into the middle of the clavicle. So nerve supply is by the nerve to subclavius. Action is it mainly helps in the stabilization of this clavicle. That's it. Now serratus anterior. So serratus anterior muscle is also called as boxer's muscle. So this muscle takes its origin from the first 8 ribs via digitations. So now the insertion of these muscle is the first digitation gets inserted at the superior angle of the scapula, and the other 2 digitations get attached to the medial angle of the scapula, and the other digitations gets attached to the inferior angle of the scapula. So the nerve supply mainly is by the long thoracic nerve, which is also called as the Bell's nerve. Action is again when it's going to contract, it's going to protract the scapula along with pectoralis minor muscle. So this movement is very important in case of punching and pushing movement. So that's why it's called as boxer's muscle. And when there is paralysis of this muscle because of this nerve palsy, so what happens is you get a condition called as winging of scapula. So where the medial border of the scapula will be prominent. So this you check where you are asking the patient to push against a strong resistance. So you are like a wall. You can see the prominence of the medial angle of scapula. So that is called as the winging of scapula. So next one is you are going to discuss about the clavipectoral fascia, which is the last topic for today. So clavipectoral fascia extends from the clavicle above to pectoralis minor below and gets attached to the axillary fascia. So we have the clavicle bone here, and below to the clavicle we have a muscle called as the subclavius muscle. So clavipectoral fascia is a fascia deep to this pectoralis major muscle. So what happens is this fascia is going to divide it into anterior and posterior lamina, encloses the subclavius muscle, and the posterior lamina joins with investing layer of deep cervical fascia above. Below it extends downwards and then it encloses the pectoralis minor muscle. Again it forms a suspensory ligament of axilla downwards and gets attached to this axillary fascia. So it is this suspensory ligament of axilla which helps in maintenance of this dome shape of the axilla. So this is about clavipectoral fascia. So when you talk about the content of the clavipectoral fascia, so here you can see you have the subclavius muscle below the clavicle and you have pectoralis minor. So you have the fascia which encloses this subclavius muscle, pectoralis minor muscle, forms a suspensory ligament of axilla and then gets attached to the axillary fascia. So here we have got the lymph nodes, we have got the thoracoacromial vessels, we have got the cephalic vein and the lateral pectoral nerve, which are all the contents of this clavipectoral fascia. So these are all the topics we have discussed today. So today we have discussed about the anatomy of pectoral region. So where we have discussed what is pectoral region and what are the important landmarks in this pectoral region. So what are all the superficial and the deep fascias, what are all the contents, what are all the cutaneous nerves and what are all the cutaneous vessels. And then we have discussed about 4 major muscles, pectoralis major, pectoralis minor, subclavius and serratus anterior, forming the content of this pectoralis region, and another important clavipectoral fascia. So with the next topic we will be discussing about the mammary glands. So if you have not subscribed to my channel, kindly do subscribe and get updated about my further videos. Thank you.